Breast enhancement is a topic that would include breast augmentation primarily, a breast lift, which is a mastopexy, or a breast reduction operation. You might also include breast reconstruction, typically after a mastectomy for cancer reconstruction. In my practice, the most commonly performed procedure in terms of the breast is breast augmentation. Breast augmentation makes a woman feel better about herself, clothing fits better. Many of my patients will choose either a saline or silicone implant to give themselves typically a 1-cup size boost. The patients that are in my practice are typically athletic. They're very commonly sort of in their mid-30s. They may have had a couple of children. They've got a little sag to the breast. So rather than having a breast lift, they may choose an augmentation to restore the volume that they had before childbirth. Younger patients may simply want to have a larger breast to enhance their body, their figure, and their proportions. Some patients may require a breast reduction, which is a reduction in the volume of the breasts. People that have overly large breasts, it inhibits their athletic ability. Clothing doesn't fit properly. They typically have neck, back, and shoulder pain. And eventually they get stretch marks and the breast keeps heading south. All of these operations can be done as an outpatient. They're typically done under mostly local anesthesia with sedation so the patient is comfortable. Afterwards, the patient can go home with an escort, and then they're seen back several times over a period of a week or two. Patients return to an office-type job within 5 days in most cases. They're not totally healed, but they're able to return to normal activities because it's hidden under your clothing. I have people shower within 2 days after these operations. Nationally, breast augmentation surgery is one of the most popular operations. It's neck and neck with liposuction. Breast augmentation surgery, by the way, can be included with other operations such as liposuction. In terms of breast augmentation surgery, in New York we do a tremendous amount of it. And there are some decisions that the patient and I have to make during the consultation. Choice of incision. There are 3 commonly used incisions. Under the breast, through the nipple area, actually the areola, it's from 3 to 9 o'clock, or through the armpit. Those are the 3 most common. The choice of incision somewhat depends on the way you're built when you come into the consultation appointment. In most cases, the implant is typically put behind the chest muscle so that there's a little extra padding over it, but in some select cases we may choose to put the implant in front of the muscle. The implants in my practice, we offer both saline and silicone implants. I go over the patient with more detail in terms of the pluses and minuses. They're both good implants. During the operation, the patient can be sat up so that we can see how it looks actually in a sitting position, not just lying back. Afterwards, with all of my operations, I typically put in long-acting local anesthetic. By putting in long-acting local anesthetic, it's different than what a dentist uses because it's numb for up to 6 or 7 hours. That way, 95% of my patients never require taking any extra medication after the surgery. I put a bandage around them, which makes them feel secure. The bandage is typically removed the next day. 2 days later, they're able to shower, wash over the area, and within the 3rd or 4th, or certainly the 5th day, they're back at an office job, dealing with the kids, driving the kids to school, whatever the case may be.